Hey everyone, my name is Kalaimani Ranganathan. Today I would like to talk about the relationship between biological factor and human behavior, implication for nursing care. Today I would like to talk about how human behavior is shaped and why understanding is essential in nursing practice. Human behavior doesn't occur in isolation. It is shaped by a combination of biological, psychological, and sociological factors. Among these, biological elements such as genetic, brain function, and hormone form the foundation. These biological compounds greatly influence how individuals act, react, and manage their health. As nurses, it is crucial that we understand how their biological assets interact with psychological and social influence. This knowledge allows us to deliver holistic patient-centered care, care that sees the patient as full person and not just a diagnosis. Our objective today is to explore how biological factors influence behavior and to understand the impact of nursing practice when we integrate this understanding with psychological and sociological perspective. We can better tailor our care to each individual needs. Ultimately, this integrated approach leads to improved patient outcome, stronger therapeutic relationship, and more effective care planning. Okay, let's take a closer look at how genetics play a role in influencing human behavior, especially in the context of mental health. Genetic factors can predispose individuals to various mental health conditions, including depression or schizophrenia. For instance, variation in a specific gene, known as the serotonin transporter gene, have been found in increase a person's risk of developing anxiety and depression. However, it's important to remember that genetics alone don't determine behavior. Instead, the genetic predisposition interact with the person's environment and psychological experience. This interaction shapes how people think, feel, and behave. As a nurse, we must be aware of this genetic risk, but also recognize that many factors are modifiable. Lifestyle, coping strategies, support system, and treatment intervention can all influence outcome. Therefore, it is vital that we not only recognize potential genetic influence but also support patients through education, counseling, and we needed referral for genetic counseling. This helps patients make informed decisions and feel empowered in their care journey. Okay, let's now shift our focus on the brain role in regulating behavior, particularly through the action of neurotransmitter. The brain uses chemical messenger like dopamine, serotonin, and GABA to communicate between neurons. These neurotransmitters are critical in influencing mood, motivation, focus, and behavior. When they are imbalanced in the chemical, it can lead to serious mental health conditions such as Parkinson's disease, schizophrenia, and depression. Likewise, traumatic brain injury or neurological disorder can also cause significant change in a person's behavior, mood, and cognitive abilities. As nurses, it is our responsibility to monitor patients for neurological symptoms such as changes in behavior or confusion, and to educate them about the importance of medication adherence, especially when treating conditions that affect brain function. By understanding how the brain works, we are better equipped and tailor our care and intervention for patients struggling with mental health challenges. This knowledge empowers us to support patients more effectively and compassionately. Okay, now let's turn our attention to how hormones influence human behavior in emotional well-being. Hormones like cortisol, known as the stress hormone, oxytocin associated with bonding and trust, and testosterone, which play a role in aggression and motivation, all have powerful impact on how we think and act. For example, chronic stress can lead to elevated cortisol levels. Over time, this impairs cognitive function and raises the risk of developing depression. On the other hand, oxytocin helps promote social connection and emotional safety bond of which are essential for mental well-being. As a nurse, it's important that we assess for possible hormonal imbalance, especially in patients with mood disorder or stress-related conditions. Recognizing this imbalance can guide us providing better care and emotional support. Additionally, teaching patient stress management techniques such as mindfulness, breathing exercise, and relaxation strategy can help reduce harmful hormone effect and improve overall well-being. By understanding how hormones affect behavior, we empower ourselves to offer more compassionate and informed care. Okay, let's continue by highlighting how testosterone and hormone balance play a key role in emotional and behavioral regulation. Testosterone is associated with aggression, competitiveness, and sexual drive, while it is a natural and essential hormone. Imbalance can lead to mood swing and increased aggression, especially in individuals already struggling with emotional regulation. This brings us to an important point. As a nurse, we must always consider hormonal influence when caring for patients with behavior or emotional issues. Hormones can shape reaction, influence decision making, and affect mental health in profound ways. A truly holistic approach to care considers the biological, physiological, and social aspects of person condition, and hormone impact all three. Finally, to help manage the effect of stress-related hormone like cortisol, nurses can teach patient election technique, provide counseling, and recommend healthy lifestyle changes. These strategies are not only simple but can be incredibly effective in improving overall well-being. The importance of psychological factors and how they influence behavior, especially in relation to biological predisposition. Factors such as cognition, emotion, and coping mechanism play a key role in how individuals experience and respond to the world around them. Instead, a person who is genetically predisposed to anxiety may develop maladaptive thought patterns that worsen their symptoms. As a nurse, we can support this patient using cognitive behavior strategy, which help them identify, challenge, and reframe negative thoughts and behaviors. These techniques are proven to reduce distress and promote healthier mental functioning. Providing emotional support is also vital when we create a safe, non-judgment space for patients. We allow them to express their feelings freely, which can significantly enhance their emotional healing. Lastly, teaching a stress management techniques such as relaxation, mindfulness, and breathing exercise empower patients to cope better with psychological changes and maintain emotional balance. By understanding and addressing psychological influence, we improving both mental health outcomes and the overall quality of care. To complete our understanding of human behavior, we must also consider the impact of sociological factors. They include the family dynamic, culture background, and socioeconomic status, all of which shape how individuals behave, cope, and seek help. For example, a person with depression may avoid seeking help due to stigma in their community, or they may lack access to mental health resources due to financial limitation or geographic barrier. This is why cultural competence is so important in nursing. When we take the time to understand and respect our patient cultural belief and practice, we build trust and deliver care that truly meet their needs. Involving family members in the care process also play a vital role. Families can offer emotional support, encouragement, and a safe space recovery. As advocates, nurses can connect patients with community resources and support groups, helping them overcome barriers to care, reinforcing a strong support system. By addressing the social factor, we strengthen our ability to provide inclusive and empathic and effective care. According to Betson et al. 2021, nurses are in a unique position to integrate both mental and social factors into patient care, treating not just the body but also the mind and emotional well-being. Why is this important? Because mental health directly influences physical health and how well patients adhere the treatment plan when mental well-being is supported. patients are more likely to follow through with care and recover more effectively. We must also consider sociological influence such as socioeconomic status, family support, and community resources. These factors deeply affect how patients manage their health and engage with the healthcare system. That's why personalized treatment is essential. Nurses must tailor care plan that align with each patient's psychological, emotional, and social needs, ensuring that we meet them where they are. Ultimately, when we address the mental, emotional, and social dimension of care, we create the condition for better health outcome and greater patient satisfaction. When nurses take into account both mental and social aspects of patient life, it depends the nurse-patient and relationship. This deeper understanding fosters a more compassionate and effective approach to care. Creating a safe space is also essential. Patients are more likely to open up and share their concern where they feel heard and not judged. This type of environment encourages honest communication, emotional expression. Through this process, trust is built, and that trust becomes the foundation for better treatment, adherence, and collaboration. By recognizing a patient's individual content, including their emotional, psychological, and social needs, we can provide compassionate care that is truly supportive. Ultimately, with communication and trust are strong, patients are more likely to follow treatment plan, participate actively in their care, and achieve better health outcomes. Okay, let's take a moment to talk specifically about bipolar disorder, which is complex mental health condition influenced by multiple factors. Genetic and neurochemical factors play a major role, often causing instant mood swings that can range from manic high to depressed low. But biological is only part of the story. Psychological triggers such as stress or past trauma can make mood episodes worse or more frequent. Similarly, sociological factors like family support or workplace stress also have significant impact on patient condition and stability. This is where nurses can make meaningful difference by helping patients recognize their personal trigger and develop health coping strategy. We empower them to manage their condition more effectively. Additionally, educating family also about the disorder and advocating for workplace accommodation can go along with supporting the patient long-term recovery and overall quality life. So nursing intervention under biological factor, assess patient for genetic predisposing neurological symptom and hormone imbalance, educate patient about the role of medication in regulating brain function and hormone, monitor patient for side effects of medication that affect neurotransmitter of or hormones, provide genetic counseling or referral for patients with a family history and mental health condition, and collaborate with healthcare teams to address biological factors in care plan. So nursing intervention under the psychological factor used cognitive behavioral strategy to help patients challenge negative thought and behavior, provide emotional support and creative and safe space for patients to express their feelings, teach stress management techniques like mindfulness, deep breathing, and relaxation exercise, encourage patients to engage in activities that promote positive mental health, monitor patients for signs of psychological distress, and adjust care plan accordingly. Nursing intervention under sociological factor, practice culture competent to understand and respect patient culture, belief, and practice, involve family members in the care process to provide a supportive environment, advocate for patients by connecting them with community resources and support group, address socio-economic barrier by helping patients access financial assistance or housing support, educate community to reduce stigma around mental health condition. Okay, critical thinking in nursing practice. Analyze how biological, psychological, and sociological factors interact each patient case. Develop individual care plans that address the unique needs for each patient. Use evidence-based intervention to support patients with behavioral or mental health issues. Continuously evaluate the effectiveness of intervention and adjust care plan as needed. Collaborate with interdisciplinary teams to provide holistic patient-centered care. Okay, let's talk evidence-based intervention. Cognitive behavior therapy like for managing anxiety and depression, mindfulness-based stress reduction for patients with chronic stress and hormonal imbalance, family therapy to address social factor and improve support system, medication management for regulating neurotransmitter and hormone, community-based program to address socio-economic barrier and reduce stigma. Okay, to summarize everything that we discussed, it is clear that biological factors such as genetic, brain function, and hormone have a significant influence on human behavior. However, these biological influences do not act alone. They are shaped and mediated by psychological factors like emotion and cognition and social influences such as environment, family, and cultures. As a nurse, we play a critical role in bringing this perspective together. By understanding and integrating biological, psychological, and sociological aspects we provide through holistic care. Using evidence-based intervention, we can help improve outcomes for patient experience behavior or mental health issues, guiding them towards stability and recovery. Most importantly, when we understand how these symptoms interact, we can deliver patient-centered care. Care that not only treated illness but promotes long-term well-being. Thank you.